So metastatic biliary tract cancer, for a long time we had no real second-line regimen. There have been advances in the front line of adding immunotherapy to gemcitabine, cisplatin. From the second line, all we really had was FOLFOX, which is like falling platinum with platinum. Didn't make a lot of sense. So we've known for a long time that irinotecan-based chemotherapy has a role here. There's a Korean study, the NIFTY study, that initially showed benefit over 5-FU Leucovorin by itself and then was a bit of a wash. There was a German study that showed no real benefit. So we did a single-arm study in the US to try to make a tiebreaker. And we did achieve our primary endpoint, which was that about 50% of patients were alive and progression-free 4 months after starting therapy. We did have to replace a number of patients who came off for early toxicity. There was a 27% grade 3 diarrhea rate, and about 20% of patients did come off before 4 months, not because of disease progression, but because of toxicity. And we did have a few long-term responders who were on study for more than a year. So clearly the regimen has some efficacy. There's a very low response rate, only one responder, but there were a number of patients who had significant disease control, and that can be quite durable. And it remains an open question of whether we should start at a lower dose to make this regimen more tolerable.